Gen AI and LLMs are going to have a massive impact on several industries, and a few will benefit more than healthcare. In healthcare, there are a lot of unstructured data and a ton of inefficiencies and significant opportunities for workforce and workflow optimization. Gen AI and LLMs will act as turbochargers for the space, particularly for healthcare payers. These include large insurance companies like Blue Cross and Blue Shield, as well as major government agencies like Medicare and Medicaid. They're going to stand to benefit a great deal from LLM adoption. This was the point emphasized in Gartner's most recent annual hype cycle report for healthcare payers. The report lists various technologies and maps them onto Gartner's famous hype cycle framework, which assesses where technologies stand in terms of expectations and their maturity. LLMs are ranked in the early stages of adoption, with an estimated 2 to 5 years until full maturity and widespread market penetration. However, the report also highlights how payers are already beginning to tap this technology. So let's talk about some of those applications. The first is around generating and summarizing content. LLMs are excellent at processing various documents and data points, whether they be structured or unstructured, summarizing that information and synthesizing it into new content. Another key area is information discovery. LLMs can sift through large amounts of text and identify the most interesting information given what you're looking for. Additionally, payers are starting to use LLMs to engage members. One example is AI-powered chatbots, which are becoming more intuitive, smarter, and more autonomous. These chatbots help members choose plans or make decisions about different healthcare options. The key takeaway here is that LLMs are highly versatile and offer a wide range of functionalities that can be used in various ways. Now, let's talk about some of the concrete use cases for LLMs in healthcare payer operations. There are a number of exciting and tangible use cases relevant to specific payers. For example, prior authorization assistance, reviewing requests for services and analyzing whether they should be authorized in advance, helping to improve the overall member experience. Streamlining plan enrollment is another interesting application where LLMs can help answer member questions and guide them to choosing between different healthcare options. Claims processing and documentation are also key areas. LLMs can extract information from claims, make decisions, and even detect fraud. Legacy system code generation is another critical use case. LLMs can generate code at an exceptional level. If you're working with legacy system using outdated code, LLMs can help bring new team members up to speed and help augment your existing tech force. Despite the promising applications, there are several challenges to overcome in widespread LLM adoption in healthcare. Some of these obstacles include privacy and security risk. Ensuring patient information doesn't leak from these AI systems is a big concern, as well as keeping the information private for this relatively new technology. Another issue is in output accuracy. While LLMs are creative, they can also produce inaccurate or hallucinated answers, which can be unacceptable in certain healthcare environments. A lack of transparency in some of these models also poses a challenge. LLMs can be a bit of a black box, and it's not always clear how they arrive at certain outputs. This lack of transparency raises concerns about decisions made using LLM-powered systems. The fourth challenge is uncertainty surrounding future regulations. There's a growing body of regulations around LLMs and Gen AI, both in states like California and in jurisdictions like the EU. This evolving regulatory landscapes introduces more uncertainty for CIO and other executives. That said, Gartner reports that leading healthcare payers are already tapping into these technologies to improve margins and boost productivity. LLMs are currently in the early phases of this rise, just nearing the top of expectations, but still 2 to 5 years away from full maturity and widespread market adoption. This timeline makes sense to me. While we're still relatively early on in the stages of LLM adoption, it's almost guaranteed that LLMs will be used widely within the healthcare setting to streamline operations. There's just so much low-hanging fruit where LLMs can be incredibly useful. I should also mention that LLMs for healthcare payers is just one of several technologies highlighted in this report. If you want to read the full report, I've got good news for you. You can access the full 80-plus page report for free, courtesy of Usher, by clicking on the link below. Don't miss out on this valuable resource. Click the link to access your free copy today, and a big thank you to Usher for providing this report. If you have any questions or any comments, feel free to drop them below. Thanks, and talk to you soon.